And welcome back. The holiday season can be a joyful and a relaxing time for many people. But once the festivities wind down, sadness and loneliness can actually creep in. After the holidays are over, the colder seasons can promote the onset of mental health issues such as seasonal depression, major depressive disorder, as well as anxiety disorder. And here now, sharing more details about this is the Medical Director of Psychiatry at EmblemHealth. And we've got Dr. Kelly McGuire. And Dr. McGuire, glad to have you with us.
Thank you very much for having me, Daren. I appreciate it.
Yeah, well, I usually say January is one of the coldest times of the year, but it's also one of the roughest emotionally. And some would think that maybe after the holidays things would get a little bit better, but sometimes it's the onset of something worse.
It's true. It is true. This is the time of year that can be particularly hard on people. We have, this after gatherings or not, where, loved ones have come together. After that can be particularly difficult for people when they're suffering isolation or other mental health problems. And also, as the days are getting colder and shorter, that can start to affect our mood too, and people can start to feel down, just like you said, with seasonal affective disorder or SAD. Sometimes also called, the seasonal blues, which is a type of depression that can come and go with the seasons. But we also have to remember that we're still in the pandemic, and that is also an incredibly difficult time for people. People are reporting a lot more mental health problems since the pandemic. And this disproportionately negatively affects, the people that were hardest hit by the pandemic. So individuals, of different racial and ethnic minorities, young adults, essential workers, and caregivers.
Yeah. How prevalent and common is this amongst our community, given the fact that we're talking about winter, we're talking about holidays, but many people will say, "Listen, this doesn't affect a lot of people." But how prevalent is this?
It's common. It's common. Mental health problems are common, and I think we need to start destigmatizing that and talking more about it, and being aware of what some of the signs and symptoms of some of our more common mental health disorders, like depression are.
Yeah, well, let's get right at it because you're talking about seeing the signs and symptoms. To the average person, we may just overlook that. It could be in common conversation. We could just be, communicating, and I could just totally miss the fact that you really are headed in a downward spiral or a bad place. So let's unpack what some of those signs and symptoms are.
That's it. That's great. Let's unpack that. So first off, let's start with, if this is going to look different in everyone. Depression isn't going to look the same in two people, but some common signs and symptoms that we see are, when people have a prolonged feeling of sadness or hopelessness. People can start to have changes in their sleep or their appetite, and this can go either direction. You can be eating more, or eating less, sleeping more, or sleeping less. You might have something that we call anhedonia, which means difficulty getting pleasure out of things that you used to get pleasure out of. This can also look like irritability. You may find yourself, this could manifest itself in substance abuse. You might be having thoughts of death or wanting to kill or hurt yourself, among other symptoms. And so, if you recognize any of these symptoms in yourself or in someone else, talk to a doctor about it. And really, what you're looking for is a change in that person's baseline. You're going to notice a difference in how that person was to you previously, and that's a sign, and that's something that we should talk to that person about, and that we should encourage them to seek help for. And if it's in ourselves, to be allowing ourselves to be talking to our medical providers about that.
Let's talk about that because talking to a medical provider, talk about mental health is not sometimes common. As we talked about, we have to do some destigmatization to get people away from what some of the common stigmas are. Why are people hesitant to really embrace mental health, especially now?
That's a really great question, and it's so multifactorial. I think we can start off with the awkwardness. of talking about, your own personal experiences and feelings with someone else, but that talking about our mental health is going to be the first step to getting the right type of care. So we have that awkwardness, we have our societal expectations. There's a lot of those on men, to be not be talking about their own mental health. We have cultural barriers. Some communities, more so than others, can create environments that can sometimes prevent people from being open about their feelings and seeking help. Some people also may have a lack of a support network. Some people may distrust the health system. Some people may put their own problems on the back burner because they have other responsibilities, or maybe just have difficulty navigating the system. And these are reasons why it's important, just as you said, to destigmatize the conversation and to encourage people to take that first step to talk to their doctor about it.
I think there's also fear, if you will, and just, from my perspective, I've talked to some people about a fear of possibly being medicated, right? And that's
Mhm.
an option, but that's one of the
Right.
stigmas that's out there. If I go see the doctor's gonna give me some or try to put something on me, and now I'd rather just not say anything. But talk to us
Right.
about what some of these treatment options are that are available to people.
There's a lot of treatment options available, and it's going to depend on where you are in your journey and the severity of your symptoms. And so again, it's going to be really individualized. And some people, they may benefit if they're having depressive symptoms. They may benefit from talk therapy alone, right? And there's going to be some people that may need talk therapy and medications. There's going to be some people that may prefer to be only on medications. And those are the types of services that you would seek through your insurance provider, through those sorts of avenues. But then there's others that are even before that. I don't know if you're familiar with sort of coaches, for instance. Maybe your employee assistance program has a coach. Those are nurses or social workers. They're coached in being able to support you with health and wellness, maybe burnout, financial issues, those type of things. And if they felt like there was a need that maybe needed talk therapy to escalate it, they would let you know. And if a talk therapy doctor felt that you may need also additional medications, they would let you know, and they would make that recommendation. But there's a broad range of services. Peers, I don't know if you're familiar with that. I love peers. Peers are people that have gone through this journey as well. We hear a lot about the folks that are suffering from mental illness. We don't hear a lot about the success stories. And your peers are your success stories. They've gone through substance abuse and they came out the other end, and they're there to walk that journey with you. They've gone through mental illness. They've had hospitalizations. They're there, no matter where you are. And there are organizations like NAMI that provide these type of supports, and there are also supports like that that are available, for instance, maybe through your insurance provider. And so just know that there's a wide range, and it's not a one size fits all solution. And if you're afraid of medication, don't not talk to somebody because of that, because there may be other fits that are better for you then. And then just know that there's also things that you can be doing on your own.
Yeah.
That right now we can be walking. We can do some sort of exercise 30 minutes a day. If you're the type of person that meditates, that's something that would be helpful for you. If you're the type of person that you can practice your faith, but also just getting sunlight on your face is helpful for you. Activate your supports, activate your friends, and your loved ones, and maybe if you don't have that, volunteering is also a great thing to do. Get yourself out there, and help others.
Yeah. Dr. Kelly McGuire, we're going to leave it there, but thank you so much for the helpful information. I think that, as we said, there's a lot of stigmas out there when it comes to mental health, but we're seeing more and more in cases across our nation. People need help, and hopefully we can provide that by just giving them some insight right here on this show. So thank you so much for doing what you did today, and glad to have you.
Thank you so much for having me.
All righty. Well, now I want you to know, if you want more information, please visit the website at emblemhealth.com, and then also follow them on social media at EmblemHealth. We encourage you, please don't go anywhere. We've got more open coming up right after this.